Hi everyone. Given the recent COVID-19 spike, I thought it would be a good time to provide you all with an update. Firstly, I want to reassure all pregnant women, women who have recently given birth, and those trying to conceive that I will continue to provide you with the highest level of care, and this standard will in no way be compromised by the current situation. There is no evidence to suggest that pregnant women are at increased risk of acquiring COVID-19. Furthermore, data does not suggest a clear increase in the risk of experiencing severe symptoms in pregnancy, but studies are small. We must remember, however, that a small number of pregnant women will still become very unwell with COVID-19. Because of the physical and physiological changes that occur in pregnancy, especially in late pregnancy, pregnant women, and in particular those in the third trimester, should be considered an at-risk group. For pregnant women who acquire COVID-19, there is no increase in the risk of miscarriage or fetal abnormalities. There is an association with preterm birth. However, in these cases, this is likely a preterm birth in order to treat complications in the mother. Reassuringly, the risk of delivery prior to 32 weeks is very small. So, what does this mean for my patients? In our rooms, we continue to practice strict social distancing, hand sanitizer is used after every patient contact, and surfaces are frequently cleaned. If you have an appointment or need to attend the hospital for another reason, for example labour or concerns about your baby's movements, and you are unwell, waiting on a coronavirus test result, or have a close contact who has recently tested positive for COVID-19, please call us prior to leaving home. Where possible, your appointment will be rescheduled for a future date where there is no ongoing risk to other people. Where attendance is essential, we will put infection prevention strategies in place immediately to reduce this risk, including appropriate use of PPE. All patients entering Francis Perry House and the Royal Women's Hospital will continue to be screened. This will involve filling out a survey on your phone, answering questions about recent symptoms, contacts and travel. You will also then have your temperature taken by one of our screeners. For antenatal appointments, we request that you come on your own, unless you need to have your partner or another support person with you. We certainly understand that every pregnancy is different, and for some women, the presence of a support person is indicated or essential. Please discuss your concerns with me or my practice staff by calling the rooms prior to your appointment. For your first pregnancy appointment, we still welcome a partner or alternative support person. My wonderful midwives continue to provide support via telehealth, and additional appointments can be scheduled where extra support is needed. Until things settle down, I consider the Day 7 postnatal home visit too risky, but promise to reintroduce this as soon as is safely possible. On labour ward, a maximum of 2 support people, including a partner, can be present, and in theatre for a caesarean section, 1 support person can attend. On the postnatal ward, only your partner or alternative support person can attend for the duration of your stay, with no additional visitors allowed. As per previous instructions, please ensure any support person attending with you is well and is not themselves waiting on a COVID-19 test result or is a known contact of someone with a recently confirmed infection. Any visitor will also be screened as they enter the hospital. The 6-week postnatal check will continue to be via telehealth at this stage. Additional postnatal concerns may require being seen in person for concerns such as mastitis. We understand that often this will mean needing to bring a support person into the hospital with you. As has been the case since the beginning of the pandemic, children are not permitted in the hospital. For women or couples planning a pregnancy, I continue to provide pre-pregnancy counselling appointments. These are more important now than ever before and enable me to come up with a personalised plan that optimises your chance of conception and then minimises risk to you and your baby during the pregnancy. If you have any questions or concerns, please don't hesitate to contact my rooms on 9347 0747. Thank you again for your understanding and cooperation at this challenging time. Take care and stay safe.